I'm an ER physician.
And you and I met about 2 years ago, and you had some serious headache pain, some problems. We actually found something in dental world that helped you. Can you tell us what was going on back in the day?
Yeah, for many years I'd been having chronic occipital headaches on both sides, really. It didn't seem to matter either side. But I'd had multiple fractured tooths, had crowns put on, broken my crowns, been through braces to see if that would help, cervical spine surgery, seen multiple chiropractors, but nothing helped. I had continued dealecs.
And you were dealing with this for like 20 years, right?
Pretty close to 20 years, yeah. I started when I was in medical school.
Right.
So that was over 20 years ago.
Right. So we did our thing, and that basically involved the exclusion time reduction therapy.
Mm-hmm.
And how were you feeling after that?
I had immediate headache relief, almost complete total relief before I left the office that day.
And were you doing good for quite some time?
Mm-hmm. Yeah, I did fantastic for over a year, just until the last few months that things have changed. And I was trying to think back. I think it's probably been about 3 months ago.
Sure.
When things got bad again.
Okay.
And it was like that same exact boring occipital pain was back.
Right. So today you showed up and we relooked at things and we hooked you back up. And basically you had busted a little bit of the bonding that we did off of one of your canines. So you had long exclusion time off to your left side. So when you walked in today, what were your symptoms like?
Well, I have been having right occipital pain and then just left-sided temporal headaches. I had my occipital area worked in the other day, so that it wasn't near as bad today, but still I was having a lot of, even this morning I woke up with a left-sided headache, which I've been waking up with headaches every morning for the last 2 months, every day. Okay. It doesn't matter how I sleep, what I do. And I just assumed it was because I was in more stress, having more stress and taking medication to sleep.
Sure. So an hour ago when you walked in, did you have that headache?
Mm-hmm.
Do you have it now?
No.
You mentioned something about like hip pain. That's a fairly new thing?
Mm-hmm. Last 2 months I've had pain on the tip of my left buttock, like ischial tuberosity region.
Sure.
I had an old injury there that I kind of maybe re-injured it. I don't remember specifically re-injuring it, but it's just over the last couple of months just continued to hurt no matter what I've done. And it's better.
Which correlated with the timing of the headaches returning.
Exactly. Yeah,
and again, today we confirmed that you kind of knocked the tip off your canine that we had restored. So today, it's only been an hour, so this isn't very significant, but I mean, you tell me, it's subjective. How do you feel?
I feel totally different. I feel more awake, more relaxed. My jaws aren't sore. Don't have that headache.
Yeah. How's the hip?
My hip doesn't hurt.
Like for real?
For real. My hip doesn't hurt.
So do you have any advice for physicians or dentists in general, just about this whole scenario?
I recognize that the headache, jaw pain, it's real. I mean, it is. I think it is systemic. I really truly think it is systemic.
Yeah.
And maybe it's an overall thing because I know I haven't been sleeping well, wake up exhausted because I haven't slept well. So it's a whole body thing. But to come in feeling that way and then have it go completely away and have it be gone for a total year and have it come back again.
It's not a coincidence.
No.
It's correlated. In general, how do you feel?
Well, I feel on a scale from 1 to 10, like at least a 9 or more better. I mean, just the fact that I always felt like there was a nail stuck in the back of my skull. It was a very strong pain that's not there now. My shoulders feel like they've dropped, and my trap muscles are relaxing. I feel very relaxed.
You feel sleepy too, don't you?
Yeah, I don't. I'm never sleepy.
Yeah.
I was on 24/7 even when I went to sleep.
Yeah.
So I feel very calm.
I'm glad to hear that.
So
Volume-like.
I guess you're glad you had it done?
Oh, I'm ecstatic. Yes.
Okay.
I'm ecstatic. Yes.
Any advice?
It's worth.
For people or doctors? Both.
I think doctors need to get on board because this is a shame. It's a shame that someone has to travel, and it's not just the time, the energy, the money, everything. to find the type of relief I'm experiencing right now,
Yeah.
it's a sin that someone would have to go that far out of their way
Yeah.
for that type of help.
Yeah, I hear you. Well, that's why we do what we do.
Yeah, and
That's why we publish these videos.
it's amazing. I
Yeah.
mean, it's worth all the time, energy, and money. It's worth it.
Okay, 0 to 10. What do you got with the ice water? What's it do? 0 to 10.
A 1.
No biggie.
Might even be a 0.
Is that fascinating?
That's fascinating. The reason I said 1 is because I felt something.
You're supposed to.
You're supposed to.
Natural.
But was it pain? No.
Yeah.
Was it discomforting? Not at all.
Yeah.
So if it's a scale of pain, I would have to say a 0.
Yeah. Yeah.
But a scale of feeling, I would say a 1 because I
Yeah.
did feel the water.
And before we did the DTR, what was your number?
It was agonizing. It hurt.
Yeah.
Yeah, I told you, right? I
Big
would
time.
not want to do that again.
Yeah.
That's incredible.
Yeah.
That
It's a
is
side effect. That's a cool.
So if anyone's watching, this is unbelievable. I just can't believe it.
Yeah, it's permanent.
Yeah.
As long as
and-
the bike doesn't get altered,
Yeah.
be careful when you get done work.
Right.
Yeah, and I don't know. We need to contact the company, the tech scan people, and see if anyone in Turkey has a T-scan. I'm sure somebody does, but they need to know what they're doing with it, not just have it.
Nobody has a T-scan.
Yeah, that'll change.
No. Yeah, I
I'll
hope
try
so.
to change that for you.
That would be good. Definitely do a TED Talk. Just talk to anyone and everyone.
And for those watching, it is true. It's not a scam or anything. I came with a lot of sensitivity. Now it's disappearing little by little. I'm here because I've been having issues with my jaws and my lower jaw. I have pain and sensitivity to my teeth.
Okay. How long has that been going on?
I will say 5 years, but it has been getting worse since September of last year, since they did a bridge.
So you had a crown done on your upper left about 5 years ago, and then you had a bridge done on your upper right last September.
That's correct, and also some other type of feelings throughout my mouth. So.
And didn't you tell me that after the crown was done on your upper left, you started experiencing cold sensitivity that you've never really had before?
That's correct. That was like 5 years ago, but it was on and off, and I tried many toothpastes and some other prescription toothpaste that the dentist gave me, but they don't help. It helped for a little bit, and then it comes back. It's a 10.
It's really bad?
Yeah, throughout my whole mouth.
Okay. And that's only been going on for about 5 years?
Mhm.
5 years. Okay.
And it lingers, though.
It does
the pain, yes, stays. It lingers.
Is it gone yet?
No, it takes probably like a minute or a minute and a half to dissipate.
A few moments from being done. What do you think? What's it feel like right now?
It feels like being in a different place. It's like I came here with hoping you were my last resort. I mean, I didn't have any place else to go.
Yeah.
And if you didn't help me, I was just going to learn to live with this
Yeah.
issue. And now that you just worked on half of it, and I can see that it really works.
Yeah.
I don't know. Look, I get goosebumps just to think. No, seriously, because to live with this every day is a pain. It's always on your mind.
Yeah.
And the people that live around you, I always complain to them, like my wife, and
And they're sick of hearing it.
that's right. And she told me that go and get a third, fourth opinion, try somebody to help you. But
Yeah.
here I am. I mean, you're my last one, and thank you, though. That helped from the bottom of my heart. Thanks.
No, of course.
Here it feels different. 100% I can feel it. I mean, the bite is different. I mean,
The face in general, what's a word? Describe the face.
I don't have the tension that I was feeling, because I was feeling a little bit of tension when I wake up. And sometimes I thought it was the pillow. I changed the pillow. And I'm sleeping in a cheap pillow in a hotel. I mean, different type of pillow. But it's relaxed. It feels more relaxed on the jaws.
Yeah.
It's like you just click something, a button, and just let it go.
Yeah, yeah. But the bottom line is, whoever did the whoever did the crown because of the thickness.
No, they had a lot of problem adjusting this crown, as a matter of fact.
Because they never took enough tooth away to give it enough thickness for the metal
And it kept
and the
hurting
porcelain.
and hurting every time I used to chew.
Yeah. Your problem is the crown here and then the fillings below it was the main problem.
Okay.
The DTR catches your bite up to the status of your joints. You're a little damaged, but not terrible so. So from here on, you naturally should keep it in line.
Okay.
In other words, brain senses through teeth where they are in time and space and pushes with muscle accordingly, tips it, intrudes it, lets it alone, whatever it needs to do, it'll dial it in on its own. But we catch you up. So it should be relatively perpetual unless somebody gets a hold of you with dental work and throws an error in.
I will be very, very hesitant to really go to any other dentist. Without having this equipment to test you and make sure that, your bite is level, I don't know. I would probably come back and see you. So.
Well, the tolerance for someone that has a little bit of damage is less than the tolerance for someone who has perfect joints. So most people, not most people, probably at least half the people though, have perfect joints. So their dentist can be a little sloppy. The dentist doesn't even know it, but they're using the bite paper.
Yeah, that's
Yeah.
through my life, that has been the experience. Just that paper.
That's all they use. And then but when you start using the digital stuff, when you really want to get serious about it, that's, in my experience, far more in line with someone that has a problematic problem.
And with my age, you saw that I have a lot of dental, fillings and crowns and bridges. So
you're no older than I am. You're just getting started.
but it was time, I guess, for something, this type of technology, to really level all my bites. So.
I thought that DTR would be a good fit for me because I've seen so many doctors and so many dentists and so many chiropractors, physical therapists. I even went to a rheumatologist and none of them helped me. They all said it was either muscle or, it was all muscle related. None of them ever did imaging or anything like that. So
you found us in the videos and you thought that some of the videos sounded close enough to what you were experiencing. Right, but no one had bothered imaging you.
Nobody bothered imaging me, and nobody would take me seriously and speak to me competently. They always brushed off, this muscle is hurting. Oh, no, well, that doesn't, affect your team day. And, you were the only doctor that I could find online. And especially in your videos, I saw people that it was like you were speaking my language. I could understand everything you were talking about. And whereas the other doctors I would talk about and they had no idea what I was talking about.
So nobody that you saw gave you any kind of real definitive?
No.
Nothing even a differential? Not even, let's try this, let's try that?
No. It was all, let's try splint, or you have myofascial pain syndrome and we have no idea what to do with you. You can go to pain management.
Right. Well, that person needs DTR.
Yeah, pretty much. I mean, at least...
Assuming their joint's clear, you have to check the joints.
Exactly. If anything, now I at least know what is wrong, and I'm not going to I'm not going to wake up one day and have my bone just gone there and, oh my God, what's wrong? And then see, and have just an even worse problem than I already have right now.
Yeah.
So at least I can catch it.
So you're going to go down and see one of the oral surgeons that we recommended, right?
Absolutely, as soon as possible, because I don't want this to get worse.
Right. And take the MRI and the CT we took today, and the information. Tell me where you're from.
I'm from Michigan.
And tell me what brought you here about 4 months ago, because you're back again 4 months later.
Nobody in my area, not one dentist, could get my bite straight at all. Every time I had dental work done, it was shifting all over to the point that I had teeth butting from the inside, front teeth into the upper, going into my sinus as well.
Yeah.
Jaw pain, headaches in the back of my head, the neck and shoulder pain, all of that has totally improved with getting the bite in balance the way it's supposed to be.
More aligned.
Yes.
Did you have the temples real bad?
I never did, actually, the whole time, except for right before I came to you, and when my teeth were more flattened by that previous dentist, that's when I was getting it up to my temples, and I never did before that. So the more my teeth got flat, the more it hit my temples, definitely.
Understood.
Yeah, but it took, I had a lot of different things going on. Like sometimes I'd have pain, but then it'd subside. It was almost like everything was releasing, and it took probably about 7 weeks before everything just kind of, settled down, and it was like the bite just felt completely normal, perfect. All the muscles were not so tense.
It takes the muscles that long to chill out, basically.
Right.
A lot of people. They're not alone.
Correct. So it was about 7 weeks for me, I would say, and I just was like, "This is wonderful. This is, where it's like feeling like your teeth are back to where you started originally as a kid," and that's the way I figure it out. That's how it feels for me. Is that when I see my kids and they're smiling and their teeth are coming together correctly, and mine just weren't, and now I feel like mine are doing what they're supposed to do. My jaw is doing what it's supposed to do.
So life is good.
Life is.
You can get away from it now. Forget the teeth and the head pain and all that. Right?
Yes, exactly. And my husband's like, if you're going to come here, and it's not just going to be for the bite, he's going to do dental work and he's going to check that bite.
So now you guys drive 13 and a half hours for a dental appointment. Correct.
Just
a normal dental work.
Yes. And that seems crazy to other people, but if you're suffering, I'm just like this gentleman I just talked to in town. I said, if you're suffering, you'll do anything, to get out the pain.
13 hours isn't too far.
13 hours doesn't seem too far. I know. I'm like, do you want to drive again? He goes, not this year. Maybe
next year.
Yeah, maybe a plane ticket at the end of the year.
All right, well, thank you very much.
Thank you, Dr. Nick. Thank you so much.
To summarize, you came to us about a year ago. You had terrible headaches, came in for a normal dental thing.
Yep.
We found that your bite was triggering the headaches.
Correct.
You were in disbelief. We tried our thing. It worked. It involved bonding some of your eye teeth, your canines, on the top. You went about 9 or 10 months without a headache.
Right.
You debonded one of those fillings over time. One of them broke out, and your headaches started returning. We rebonded about a month ago, and your headaches have completely gone away again.
Correct.
Okay, so today we're going to sit here and we're going to replace that area with something out of ceramic that's very hard. So good luck breaking it. You should be able to.
Right.
Yeah, the bondings are a little weaker, so that's plausible. Those can break quite easily, but the ceramic will not. So, no problems.
No problems at all. And it's really, the first time it was kind of you never know, it could have all happened at the same time, but once it broke, once the tooth broke, I think we're looking at 3 or 4 days. I had my first headache. And then one every couple days, got worse. Finally, I came in and saw you. You fixed it. As I recall, when we first left, I might have had a headache within 24 or 48 hours.
Yeah.
Nothing after. So I don't know if it was residual or from something else, but certainly it goes from having multiple every week to almost negligible.
So in your mind, you're convinced this is what fixed it, right?
Yeah, I've been through everything, like I've told you before, and they give you a pill. If you have a headache and you take the pill, technically it should work. Well, it doesn't. If it worked, the pill fixes it. Same with this. You fixed it once, it broke. They came back. You fixed it twice. They went away. So it's kind of hard to deny.
Call a sheep a sheep.
Yeah, it looks like a sheep. Yeah.
And I kept going back. I went back to him 5 times, saying something's not right here.
Get the bite right.
He said, there's nothing else I can do. It's a root canal. The only thing I can do now is a root canal. In England, it's not quite like here where you have dentist surgeries, but you'll have multiple dentists in the same surgery. So I saw the same guy about 3 times, and then I went and saw another one in the same practice. And he explained to me, sometimes it's like the size of what you've done, it might have moved, but yeah, just bite ribbon, and then he shaved it.
That's the way we'll stop the pain.
Yeah.
Yeah.
But if he had done that and then made the bite right, he would have messed up with the other teeth.
The bite ribbon that dentists traditionally use is essentially fraught with error. It's very subjective. The T-scan linked to the EMG is like the opposite. The T-scan sensor has been shown in the scientific literature to be in the 95th percentile accurate relative to force and time. So a piece of paper with ink that's about 12 to 20% versus a sensor that's digital that shows me force and time and it's 95% accurate, it's kind of common sense which one I'd rather have my dentist using on me. But those sensors cost money, and there's a huge learning curve as to how to use it properly. bite ribbons, what everyone's taught in school. And most dentists never use anything else. Most dentists aren't even aware of those percentages I just told you about. So if you start putting this timing parameter into this whole equation, and you start realizing that, hey, if timing makes a difference for my bite, and that could be responsible for these non-specific pains I have around my head and neck potentially, maybe I can start fixing things as long as I rule out the joints as being part of the problem. They may not be perfectly healthy, the joints themselves. They may be slightly damaged because many people have damaged joints. But we're ruling that out with the MRIs and the CTs.